Good afternoon, Chair Bonta and committee members. I'm Carmen Comsti, Lead Regulatory Policy Specialist with the California Nurses Association. Since last session, we've worked diligently to incorporate feedback from legislators and stakeholders, and we want to thank you again for your time today, and I want to touch on some key components. CalCare is ultimately a reinvestment of our healthcare dollars into care instead of ballooning prices, administrative complexity, and corporate profiteering. On savings, the Healthy California for All Commission also found that it would save $40 billion each year on insurance administration alone. And when it comes to receiving care, CalCare eliminates insurance barriers and financial barriers to care. CalCare creates one network of providers spanning the state where care would be free at the point of service. With CalCare, we would get more, pay less, and provide comprehensive benefits and high-quality care to everyone. This framework importantly establishes the policy legislation required under federal law to begin negotiating federal waivers needed to incorporate public programs into CalCare. For provider reimbursements, CalCare aligns payments closer to cost and uses our bulk purchasing power to win fairer prices for everyone. For rural and underserved areas, payment rates would be adjusted upwards to ensure that they have the resources they need to stay open. By stabilizing funding for hospitals and clinics throughout the state, we can finally combat the epidemic of healthcare closures in rural and less affluent areas and for communities of color, which leads us to a really important point of CalCare. It creates the framework to begin dismantling the structural racism and structural health inequities that our current system is built upon. A new Office of Health Equity would identify distributional gaps in our healthcare infrastructure, and it would develop programs to address disparities in rural and medically underserved areas, including programs to meet the cultural and linguistic needs of all patients. Savings from the elimination of insurance administration and profiteering could be used for additional staff, extended office hours, or hospital renovation and construction, and to boost healthcare staffing and other resources. The bill includes provisions on healthcare workforce recruitment and retention. Programs and funding would be available to build a diverse workforce pipeline and to keep nurses and other healthcare workers in good, safe jobs with safe staffing levels while they care for patients. Passing CalCare's policy legislation today is an important first step that California needs to take on the path towards implementing guaranteed health care for all as a right. Thank you.